I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go. Welcome. Thank you all so much for joining. I was able to fix my mic issue the past few streams. I've had an issue with my mic, and it's because it was turned down on the physical mic. So hopefully that is fixed. Today, I wanted to do a recap of week 3. I was on a cruise, and so I caught up over this past weekend. The trial testimony from last week, there's a lot that's happened. There's a lot that's happening today. I will be going live again at 6 p.m. Eastern. There is a defense expert that's testifying right now, and I want to have a chance to take a full look at his testimony. I have some clients between now and then, and so I will take a look at that later today, and we will be going live tonight at 6 p.m. to talk about Lindsay's mom, Patrick's mom, and a lot of that testimony. Let me know if you all have any general questions, really pertaining to last week, if at all possible. I am caught up for this week, but we will take a look at that. So, Dr. Tufts, I thought direct examination went well. Cross examination was tough. And for me, watching the cross examination of really a lot of the mental health experts, I was surprised at how much the person not having a plan, that meant that they weren't referred for additional services or for something else. That if somebody is telling me that they are having constant intrusive thoughts for a period of time. Now, I'm not sure if Lindsay was fully communicating to them some of the fear, and the defense is doing a good job, I think, pointing out any potential bias because there is the pending malpractice or the civil lawsuits are out there as well. And I know Paul from Reporting Live from My Sofa. He has been covering some of that. And I know a few other creators have been covering the civil side because I believe Dr. Tufts has asked for a review, for a psychiatrist to review what she did and determine whether or not things should proceed. We will see what happens on that civil side. Right now, we are focused on the criminal side that Lindsay has been charged and she's on trial for this horrific incident. And I think the state is overplaying their hand. I think they could say, yes, she was struggling. Yes, she may not have been completely, or because I think from the state's perspective, I think they want to say that that she was manipulating. I can't get the state side fully. The state did rest this week, and I'm looking for their rebuttal case. And a lot of people have questions about why the state hasn't presented their expert now to say why they believe that Lindsay was criminally responsible for this incident. The defense gets to go first. So the defense is presenting their experts, they're saying their side, and the state wants to go last. So they want to make sure, because the burden is on the state to prove this. And so their experts will actually go last. That'll be the last thing that the jury hears. And so we will see. The state also, I don't know, I think they have reports of what the different experts are going to say. So the state is prepared, and I'm sure their experts are prepared as well. But sometimes up on the stand things happen, and so that's why the defense is going to go first. I do not think that Lindsay is going to testify. I've heard people kind of thinking about that, talking about that. I don't think that she's going to get on the stand. I think the mental health experts are going to say what she told them. They're going to say what's in their record and what kind of came up. I do not believe that she is going to testify. Somebody mentioned that things are different in Florida. Baker acted, yes, and that somebody was Baker acted multiple times. Now, I wonder if because Lindsay was a nurse and she had a supportive husband, and because I wonder if I wonder if things were different. I know in my area, sometimes there can be a lack of availability of beds, that sometimes a person they might want to hospitalize somebody and they might not be hospitalized because there's not a bed available. But, there really was this focus on her not talking about a specific plan, and also, I think sometimes the experts or no, her former providers not being aware that she had called the hotline and those different things. All right. Yes. And it's normal, I think, sometimes for people to struggle with being completely open with their providers, but that's where if you then want to hold the providers responsible for what they did or didn't do, if they didn't have all the information, that does make it a little bit more difficult. Dr. Tufts to me came off a little understandably, but kind of defensive when she was up on the stand. I do have my notes. I'm finding my notes for this part. All right, because I have the week one. Sometimes my notes don't populate over to different devices. Um, but I did think that the defense is doing a good job pushing back on the testimony that the state was trying to get out there. I think they're both looking at the same evidence and seeing it a completely different way. I would not be surprised if this jury deliberated for a long time. I could see potentially like a few days. I would not be surprised if they were hung at some point. They may come to a unanimous decision. I do also think that some things might have come up or been said in this trial that if Lindsay was convicted, that she might be able to bring up in an appeal. Specifically, the state just oh, because she was willing to stipulate to certain facts. And I think the state wanted to present their case fully. And, I've gotten conflicting reports. So I've heard from some people that are in the courtroom that the jurors are very stoic and they're not showing any emotion. Somebody, I think from I don't know, somebody else had mentioned during the 911 call that they saw tears in a few jurors' eyes. I don't know. They do have 18 jurors just in case anybody on that jury decided like this is just too much. I can't like this is affecting my mental health. Like I can't proceed with this case. But I think so far they haven't lost any jurors. This was the one question, and so the judge cut this off real fast. The whole this happened today when the state asked Patrick's mother about being Catholic and about red rum being a cardinal sin. Like, and the judge did instruct the jury to not consider it, but like that was, and I don't know how any people on the jury like how that will sit with any of them. Like that was a lot. And I do know that the state did want to get to talk to, Lindsay's priest that's been visiting her, but normally there is a, like, spiritual, like, that's able to stay confidential. I know in Sarah Boone's case, I think she asked for the chaplain to speak on her behalf, like, I think that was something that Sarah Boone wanted. I don't think that chaplain would have said anything or offered any information if Sarah hadn't asked for that to come forward. Um, I did think it was interesting how the doctor, um, I think she was a nurse practitioner. The nurse practitioner at the women's practice that focused on perinatal health, how that the one who left because she moved, and I think she started that practice. The defense was very kind to her, very, very kind, and I believe she's the only nurse that isn't included in or former treating provider that's not being sued. I don't know if the jurors will I don't know. They'll because the jurors are just looking at the facts. I noticed it. I don't know if they'll really mention anything about it. Let me know if y'all have any general questions about the things that happened last week. Really, my biggest takeaway was just the difference in how Dr. Tufts was on direct examination versus how things came across on cross examination. The state did try to use redirect to kind of clean up some things, but, like, once certain things are said, they're said. Once certain things are out there, they are completely out there. Um, let me 'cause my notes are not pulling up. That's when sometimes I have too many places that I take notes about things. Yes, there we go, cross-examination, I found it. So, during Dr. Tuft's testimony, the defense brought up the fact that her residency was during the pandemic and that she had just received her final licensure or, like, her board certification as a psychiatrist right before she started treating Lindsay. And just because somebody is a new doctor, that doesn't necessarily mean that they aren't qualified. I do think that people have to be careful how they are marketed with on a practice website. So anytime somebody's ever asked me for a bio, I always ask to review it to make sure that it's accurate. I've done some media, and with that, sometimes they accidentally put PhD or they say I'm a psychiatrist, I'm a psychologist, and so I will have them make those edits. So I specialize in the treatment of trauma, adoption related issues, ADHD, things like that. But I don't market myself as a play therapist or as something that or an art therapist, something that requires a specific residency. There are, I think a lot of medical doctors, they'll say they have an area of interest. Um, but it was just the defense really did work hard to attack the credibility of Dr. Tufts. As I mentioned, her demeanor was completely different while on cross-examination. She did wear a jacket, which I appreciated. It's just a blazer, just because on direct examination, it's fine. She had on like a white button-up blouse, which was fine. But uh she did wear a blazer on when she came back to court for cross-examination. And, so that's where the defense mentioned that she advertised herself as a specialist in postpartum, women's health, trauma, and anxiety, perinatal. The defense brought up her potential bias due to the civil case. Doo, doo, doo. And like I said, the defense really went at her hard. They tried to bring up the fact, they tried to ask her, did she mention any of the side effects of Prozac? And Dr. Tufts really talked about the fact that she thought Lindsay had done well on that medication in the past, and so she didn't really think that there was any reason why she wouldn't do well on Zoloft or a different medication. Um, doo, doo, doo. And Dr. Tufts, I mentioned so I made a note that she smiled when the attorney stated that due to telemedicine, she wasn't able to give Lindsay a hug. And I think that smile was just like a nervous, like I don't think she was smiling or laughing, but I think it was just like a nervous thing because she did follow up with the fact that even if Lindsay had been in the office and emotionally distraught, she likely wouldn't have hugged her. That physical touch within psychiatry and a lot of therapists. So I'm the type of therapist, if a client is sobbing uncontrollably, I have weighted blankets. I can turn down the lights. I have a weighted sloth. I have these different, but I don't physically like put my hands on them to comfort them. That's not the type of therapist I am. There are therapists that do use touch in a therapeutic way. I think that can cross boundaries and lines really easily. And so that's why my thing is no touchy. No touchy, no touchy. That clients can ask me for a hug and it's a side hug. It's not like every session. It's normally at the end of services and it's like as we're leaving, like doors open, next client is sitting in the lobby, like it's never this like private moment. And so all right. I did make a note that the defense and the defense kept cutting off Dr. Tufts, and the judge did have to intervene, but also Dr. Tufts was answering the questions she wanted to answer and not necessarily the question that was asked. So she wouldn't just say yes or no. And um uh the defense definitely questioned Dr. Tufts' decisions, especially with the side effects for Zoloft, including insomnia. And um they did bring up the fact that thoughts of SI were mentioned on December 1st, and that she denied having a plan. And they talked about how patients sometimes minimize their problems. The defense brought up about being worried about the government. So if I have a client that tells me they're having thoughts of harming someone else, I do have a duty to warn. So I would reach out to that person's significant other. I would include them in safety planning. That wouldn't be a call to CPS. Now, unless they told me that they had done something to harm the children, or if there was nobody else available in the person's life that could help them support and that could be a part of the safety planning process, then that's where sometimes a prevention. So we'll be contacting Child Protective Services as a means to prevent something bad from happening. It wouldn't be an automatic, the children have to be removed from the home. That is often a worry for people. So I know a lot about the mental health system because I've been a licensed psychologist for almost 20 years. And I've been practicing under supervision since 2005. And so that's where so my 20 years will be in 2010. No, so 2030. Yeah. That'll be my official 20 years practicing. And so under my own license, but yeah. Um it was so tough watching the back and forth. I thought at times she came across confusing. Um they asked her questions about blood levels, and every psychiatrist is going to have a different perspective. As a therapist, I will often encourage my clients. So if I'm working with a client that's having postpartum issues, they not only work with their psychiatrist, they're also working with their medical doctor and possibly their OBGYN, because sometimes it can be a hormonal concern. It can be, and the psychiatrist might not always catch a hormonal concern. Their OB might be the one that orders the levels of their hormones or takes a look at the thyroid. I normally recommend a team approach. And so I hope, if for nothing else, that we get from this trial, that not putting care all in the hands of just one person, that I would collaborate with the psychiatrist. Sometimes I'd recommend that they talk with their medical doctor and also their OB. And then, depending on what was going on, they might have to meet with an endocrinologist, potentially. Not necessarily, but because normally just with the OB and the other people, we're able to work things out. Um, all right. And so And the defense did a good job bringing up what I was thinking, that in a telehealth appointment, you wouldn't be able to see. Now, sometimes, so right now I'm shaking my leg and you can see the chair behind me shaking. So even though you can't see my leg shaking, you can kind of see that there are things that you can pick up on telehealth, but there are also things that you can't. And when safety is involved, so if I'm working with a client with like chronic thoughts towards self, if they're being evaluated at the ER, if they're being evaluated, if they've been discharged from a psychiatric hospital, I always follow up that next session in person because I don't want to miss anything. There is a difference between active SI versus passive. And I think Dr. Tufts did a decent job talking about that. Um, uh, and once again, I thought on direct examination, I think she was prepared. I think she knew what the questions were going to be. And the state does quite a bit of leading sometimes. I'm not a lawyer, I just watch a lot of law stuff. Um, but on cross examination, it was a little bit different. Um, they talked about that because I think the state then cross-examined and, or the state did redirect or whatever, yes. So the state kind of redirected to try to clear up some things, but it was a lot. Um During I think it was the medical examiner's testimony, that was the very emotional day. That was a very emotional testimony. I did not watch that day. I mentioned to you all, and somebody asked me, because before this trial started, I did a video about protecting your mental health as you watch this trial. And somebody asked, how did I know that it was gonna be this tough? And it's the details of this case. I didn't know the state's perspective was gonna be so polarizing because I think the state is trying to say, even if she did have mental illness, like, it's I don't know, like the state is taking one perspective, and then the defense is taking this other perspective. Often reality is somewhere in the middle, and so but the jury is gonna have to decide where things fall based on the law. Not based on emotion, not based on any of those things, not based on wanting justice for those 3 precious children, not based on any of those things. They're gonna have to base it on the facts introduced in this case, the evidence, and then also based on the law in Massachusetts. And, I don't know where this jury is going to fall. A lot of chats have been and thank y'all in the chat for not being, because I was in some chats earlier and people were really out there. I will say again, I haven't seen anything that would make me think that that Patrick was like knew that this was going to happen or caused this to happen. Because I had somebody leave a comment about like gaslighting, manipulation. I've definitely covered coercive control. I personally wonder about how their marriage was. Um, but there's been no evidence that there were any major issues or concerns within their marriage. That's just a personal, just like, I wonder, because often after the birth of a child, marital satisfaction normally dips for a period of time in any relationship, just because that adjustment can be a lot. And I don't know if Lindsay had any, like, how she felt about, you know, their relationship and everything. There is a new book by Nedra Glover Tawwab called Balancing Act. And it just talks about like communicating needs and about not trying to be a super mom or superhuman, a superwoman, a super person, that sometimes you have to have balance. Because a lot of what I heard that's been presented in this case, it seemed like, and so I'm not saying this to blame, I'm just pointing out what I've heard listening, that Lindsay was involved in a lot of these parenting groups, and that, based on that, her journal entry where she talked about being concerned about not being able to treat her third child or even her second child the way that she had treated her first child, you will never get that back. So as a parent, so I only have one. And not it's just that's just the way things happen. I have a friend that has 2 kids, and sure enough, for the first child, she did the monthly photo shoot, for the 1 month, 2 month, she was able to do all of that. She made a baby book for her first child. She did all of those things. And then for her second child, like, you just kinda settled in a little bit, and I think she forgot a few months, like, she had 2 under 2 years old. So when she had her second child, her first child wasn't 2 years old yet. And, as a friend, I went to, help her out, just for, like, a week or for, like, a week. I only went it was less it was a week or less that I went to just kind of be with her for a little bit. Um, and you're never gonna get that back, and that's something that sometimes a person has to grieve. I we heard from Lindsay's former therapist, and, but I think it was like 4 it wasn't a ton of sessions. I think it was about 4 sessions, and, it's really common that a person puts a lot of pressure on themselves. I got out of some of the mom groups, or if I'm still in some of them, sometimes I mute notifications on them because sometimes there is no perfect way to parent. Each person has to figure out what works best for them. My kid gets way more, like, screen time than his doctor probably recommends or would like, but, like, it works for us, it works for our family. I'm not a bad mom because I let my kid have some a few hours of extra screen time. Because sometimes a person can think like, "Oh, I'm a bad mom if I let my child cry. I'm failing as a parent if my kid, you know, falls and hurts themselves. I'm failing as a parent if I can't, do this or that." And, it did sound like, she was concerned that due to having to stop nursing. So I've worked with multiple women that at some point during, post in the postpartum period, they might have had to wean earlier than they wanted. And as a therapist, I'm always validating because sometimes it's just like my kid needs more than I can produce. Um, I need to I need to get back on a medication for my migraines or for something else that it's not safe for me to nurse while I'm on it, or for my own mental health. I need to consider some medications that aren't. And sometimes people, they really can feel like they're failing as a person and failing as an individual. And that's where giving yourself some grace. Um, I wish so. A friend of mine, Dr. Sasha Hamdani, she just came out with a new book, Too Sensitive. I am going to try to see if I can get her to come on for us to have a conversation. If I can't have a conversation with her, it's okay. But the book is about individuals who feel too sensitive, rejection, resilience, and the science of feeling deeply. She is a psychiatrist, and she's a psychiatrist that specializes in ADHD. And so she didn't make it specifically about rejection sensitive dysphoria, RSD, but she did just make it for women that feel like they're too much. So, I'm just gonna read the foreword. I'm just gonna read, like, this little front part right here. For anyone who has ever felt like they're too much, a breaking guide to understanding emotional sensitivity. Overly dramatic, irrational, too sensitive. These are some of the labels applied to those of us who are emotionally triggered by everyday moments, whether it's a delayed text message, a last minute invite, or a subtle shift in tone. What begins as a flicker of uncertainty can spiral into self doubt, shame, or withdrawal. From the outside, these reactions may seem overblown, but what if emotional sensitivity is not a personality flaw, but rather the result of a highly responsive and attuned nervous system? And Too Sensitive, Dr. Sasha Hamdani, known for known to her online following as at the Psych Doctor MD, offers an accessible explanation of emotional sensitivity as well as practical guidance for how to manage it. For many people, especially those with ADHD and other forms of neurodivergence, emotional sensitivity may be recognized as RSD. Feelings of being excluded, overlooked, or dismissed are not all in our heads, but are based in our biology. And so, this book, Too Sensitive, Dr. Sasha Hamdani. I'm going to get the audiobook. She mailed this to me, and me reading, I'm not gonna read it. It's not so my ADHD, I do better with audiobooks, so I'm gonna order the audiobook and we will go from there. I mentioned that because, I might be getting into this week's testimony a little bit. I'm just gonna quickly mention that one of I think a former coworker of Lindsay's testified that, she would cry after, like, women like, she just thought the birthing process was beautiful, a child coming into the world, like, that would make her very, emotional, and there's also been a lot of testimony that she just didn't feel like herself, and, I don't think medication was going to fix all of it. I definitely understand a person thinking that, like, the medication is making things worse, and, somebody commented because, Lindsay complained of memory loss and that or, like, having trouble remembering things, and that might have been why she was taking those copious notes of her side effects when she was taking medication, all of those things, if she was having difficulty remembering things. Now, at the end of week 3, my general thoughts on postpartum psychosis, what's possibly going on in this case. I still have questions. I still need to hear from the defense experts, from an expert that's actually met with her, because there is still a difference between intrusive thoughts that are constant and chronic. And just a person starts to get hopeless at some point, sometimes that can lead to action and like a negative action that nobody wants. But then also there can be um, psychosis, and I don't think that Lindsay ever told somebody prior to this incident that she was hearing the voice of somebody else. And because up to this point, it sounded like they were her thoughts. And so I do want to hear from the defense expert. And then I wonder if the state had somebody evaluate her as well. So we will see how things go with that. Hey, Mama, welcome, welcome. Thank you all so much for being here. So thank you for doing this research. So postpartum depression can come in stages. Some people just get baby blues and it doesn't present any further than that. Some people get postpartum depression. Some people may get postpartum depression. I'm sorry, postpartum psychosis. No, postpartum depression. Yeah. And then some people may get postpartum psychosis. Do 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 do. And then I want to make a correction because there is bipolar disorder postpartum onset, but that would be a continuing bipolar disorder. It wouldn't be because sometimes postpartum depression doesn't mean that the person then has major depression and ends up depressed for the rest of their lives. Like when I think of postpartum depression, I think if we can resolve these symptoms, if their brain can get back to more stable functioning. Some clients that I've worked with over time, they were able to get off medication. Some people stayed on medication. And so that's where is it generalized anxiety postpartum onset, but bipolar disorder postpartum onset, that would mean that a person like that that something kind of triggered all this. I am not a psychiatrist, but I do know that sometimes SSRIs can trigger hypomanic or manic episodes in individuals with bipolar disorder. Normally, the family people would notice, especially for mania. Normally for mania, people would notice. Um, there would be this intense change, like there would be these mood shifts, and I think that's why the state is questioning whether it was bipolar disorder. I think that's the state's question mark. Welcome, welcome. Thank you for coming on over. Do you have any questions, Emily? I know when we were over in Paul's chat, you mentioned that you have some questions. Not questions from this week, but any questions from last week. I am still catching up. And so thank you all. Thank you for being a member for 18 months. Um, I am starting to wrap up. Let me know if y'all have any general questions. I will be live again tonight at 6 p.m. talking about this week. So we have got to talk about Lindsay's mom, because Lindsay's mom might have said something that might have hurt her case a little bit, but I don't know. We have to talk about Lindsay's mom. We have to talk about Patrick's mom. And then there is a defense expert that's testifying about the mental health side. My main question is was this true postpartum psychosis or postpartum depression that then worsened to postpartum psychosis? Was it the medication? And so it sounds like the return to work and being away from the children, it seems like she was, I don't know. So that's where I need an expert that has actually talked with her. And the most important question is going to be, at the time of this incident, does she understand the difference between right and wrong? I know a lot of people are talking about the Apple Watch being in the drawer, like that she took off the Apple Watch. Could a person in a psychotic state do something like that? It's possible. A lot of people are saying like, no, like there's no way somebody could do that. The state seems to have presented their timeline. I'd be interested to see what the defense says. Yes. Yeah. So we'll have to talk about this at 6 p.m. tonight, Emily. My short answer, bringing up the thoughts to harm the children from December. But I don't know when the defense is saying that the psychosis started. I don't know. They might be trying to go back and say it started as early as late November. I don't know what they're gonna say. Sometimes individuals that are in psychotic states don't have great insight. We learned that from a different case. Which case was We learned that from another case recently, where one of the experts talked about how individuals with psychosis, it was the Carlos Dominguez case. There was an expert that talked about schizophrenia and how often individuals with psychotic features or psychotic, sometimes they'll deny that they're psychotic. They won't report the symptoms. Other people normally observe it. And so I personally haven't worked with somebody where I couldn't see the psychosis starting, or I didn't recognize, like, their behaviors just got odd. They were doing weird things in session. There's this feel that I can't explain it, but there's just this feel. Um, and where I had the family monitor them more, where I monitored individuals more. And if they did endorse, psychosis, then they, sought appropriate treatment. But I'm not sure. Let's see. I had a client in psychosis and they could do certain normal things, but their mind would be racing and delusional. Yes. So that's where normally people would notice. Normally there would be some sign. I have worked with people where, um, with psychosis, it was just kind of this voice all the time. Uh, but I don't know. This is a hard one. This is a hard one. Um, all right. And so for some people, medication saves their lives. Oh yeah, there we go. Okay, so you said I wish people quit attacking the medications as the cause. Yes. And so a lot of people I've worked with many people that have been on some, or possibly, I'm not sure if anybody's been on amitriptyline, probably, but I can't remember that one. But definitely Zoloft. Zoloft is a really common one. I can't count the number of people I've met with that have been on Zoloft or Prozac. Definitely met with clients that were on Seroquel, that were on, Remeron is a newer medication, but I have worked with people that were on that one. Um, and Dr. Tufts made a point that she did end up prescribing mood stabilizers toward the end. And I don't know. I don't know. Uh, and that's where I hope that men learn from this, or that people in people's lives learn that, um but that's where I don't know that she had a ton of red flags before, which is hard. That's what makes this harder, and I can't get past his testimony that he said the day of the incident was one of her best days, and that he didn't notice anything off. She wasn't speaking off, she wasn't nothing, there were no red flags for him, that seemed like one of her better days, which for me makes me wonder, because sometimes when somebody has a plan to harm themselves, sometimes they get this joy, like they get this burst of happiness, because they think it's, so that it's for not great reasons. And that's, I get very concerned if I'm working with somebody that has really low mood, and then all of a sudden they get happy out of nowhere. If they start giving away things, if they start, there are certain red flags with that. Some people do an impulsive act, and it wasn't planned. It's not any of that. But this just feels a little bit different. There have been multiple other cases recently of individuals harming themselves and their family. I saw one. I don't know if it was in Kansas. It was like a husband and a wife. They planned together to harm themselves and their children. Let me see if I can find that one real quick. Oy, that was what? I think the father was about to, like, yeah, a Kansas father planned harming himself and his children. His name was Ronald Williams, and yeah, he and his wife harmed their children and then themselves, and that was just, that's so odd. And sometimes when things are so odd, we just wanna say, like, "Is this mental health or not?" Because it just feels, and I don't like the word crazy, but that's kind of what people say. How can we help a loved one going through something like this? Yes. How do we ask the hard questions? Sure, it's been no, no, no. So this is a great question. So if you have somebody that you know that is kind of down, sad, maybe struggling with their mental health, letting them know, like trying to listen without judgment. So if they say, "I'm having a really tough time. I'm here for you. Let me know if you need anything." I can see that this is hard, because sometimes people want to make people feel better by saying, "You got this." Like, "You're doing better than," I don't know, like, sometimes people try to give people hope before connecting, and before connecting with them in in their pain. Brené Brown had a great video on sympathy versus empathy. Let me see. I'm not gonna play it. I think I've played it on my channel before, but if you type Brené Brown empathy versus sympathy, it'll come right up. And it's a little animated short, and what it talks about is that empathy sympathy is like, "Oh, that sucks. Oh, that's hard. Oh, that must," I don't know. But empathy is trying to get down with the person in the midst of their pain. And so this is the video, empathy versus sympathy, and it is really great. It just kinda talks about that part. Yes, it's okay to not be okay. Exactly, exactly. Yes. Because, with 'cause to me, it seemed like Lindsay desperately wanted to be okay, but I don't think she was. I think she was struggling, and I think she had a lot of guilt and shame about how much she was struggling. Vulnerability is incredibly difficult. There have been times where I was really vulnerable with friends, and I'm, like, shedding tears. Yeah, definitely don't ask, like, "What are you depressed about? You have 3 beautiful children, like, appreciate your life." Definitely don't say any of those things. That's yeah, that's not good. But being able to let them know that it's okay to be with them in that. Um, Individuals that have strong thoughts, especially thoughts of SI, because sometimes they feel like they have a bad life, and they're having a bad day. But that's where therapy, encouraging them to talk with their therapist, encouraging them to make sure to share these thoughts. If you have, so if you're a spouse or if you're the emergency contact for a loved one, and if you're concerned that they're not being fully transparent with their provider and you know their provider, sometimes you can provide information to the provider just can't say anything. So if somebody called me and was like, "Hey, I know you have this patient. I know you can't confirm that, but I just wanted to make sure that you knew that they were having thoughts about like harming their kids or something." I'll be like, I'm like, I can't confirm or deny. I'd hang up the phone and then, I'd have to figure out what then the next steps were um, in person. So if you know somebody that is struggling like this and you find out that all of their sessions have been virtual, really encouraging them to go in person. In person just feels different. Um, Sometimes for a new parent, virtual works because, you have the baby. I let clients, especially new moms, bring their baby with them to sessions. It's not something that they have to do with, but we don't talk about like trauma or like we talk about how are you sleeping, how are you adjusting. I get to see them with the baby. I get to see their interactions. That's something that I personally do. There are some therapists and psychiatrists that don't allow children to be in session. I find that it's really helpful because I can see if there's like a disconnect between my client and their child. I can see because I've worked with some clients where their child was very colicky. Like their child just cried all the time for no reason. And that often makes a parent feel like I'm doing something wrong. Like, what am I doing wrong? How can I help? And I was able to give them tips and recommendations. Hey, try this. Parents don't have to be perfect. When parents mess up, we just want to like apologize. We want to be there, be as present as you can. Um, but there's some things about this case that's just it's really heartbreaking. And like Emily said, and others have said too, we just want to find like a healthier, safer community. And so uh um yeah, this is a tough one. So we will be talking a little bit later. You're an outreach therapist. I go to home so I can see what's going on. So there are some states that offer in-person crisis stabilization. So I know in our area we even have like I don't know if it's still open, it might have closed. But there was this like stabilization house that wasn't a hospital. So it was a lower level. So the person had to be safe enough to be in like a house because the acute facility, the hospital is like a locked facility where they take your shoelaces. That's where like the whole grippy socks, because they often, you kept sometimes you're wearing slippers or um because you're not able to wear shoes with laces. Um, but it can be very restrictive. Sometimes a person, and the focus of those short term stabilization, it's medication. Like the main focus is medical, is um, is medication. It's normally not therapy. The partial hospitalization programs often offer therapy. They often do medication management as well. And so or intensive outpatient. And the difference between the 2 is which program your insurance will pay for, unfortunately. I think partial hospitalization is normally Monday through Friday, like from 8 a.m. to sometimes like 5, because it's normally during the day for partial hospitalization. Intensive outpatient might be 3 to 4 times a week. It's just its services a little bit more frequent. Uh, I'm outpatient in Massachusetts. We also have in-home therapy. It's just for yeah, it's for kids. So in Virginia, we have in-home therapy for adults too, but they have to have Medicaid. So it's only Medicaid funded, and if they have a history of hospitalization. There are very strict rules. In Virginia, it's called mental health skills building. They might have changed it. I haven't been working in community-based mental health for a while, but back when I was doing that, that was the service that was provided. All right. I appreciate you all. I will see you all a little bit later today about 6 p.m. I'm also doing a stream over on my second channel talking about our Disney cruise. And so if you'd like to follow me over there, it's Dr. I have it on the community tab. I have a link to that channel posted. It's Dr. Barry navigating neuro no, what is it? Navigating neurodiversity with Dr. Barry. That's what it is. Yes. Ay, so hospital stays are expensive, are expensive. Um, well, one of the meds she was prescribed was $34,000. Wow. Wow. Wow, wow, wow. Sometimes and that's probably a newer medication. I wonder if that was the Remeron, because I think Remeron is one of the newer medications. Um, yeah. Right. So, be kind. Don't do crimes. Take care of your mental health. Take breaks when you need them. I will see you all a little bit later today. Have a good one. Bye.